Everyone, I'm your host Sarah, and welcome back to the Spoony Life and Beyond. So, today we're doing a deep dive into bipolar disorder. Just letting you know that this is not for medical purposes or medical advice, this is actually just for awareness purposes. Also just quickly letting you know that I am visually impaired. So I follow text to speech from my research. So sometimes I may stutter or get a little bit lost. I do apologize in advance. I'll just get into the deep dive. So let's dive in. So bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings. These include emotional highs, also known as mania or hypomania, and lows, also known as depression. Hypomania is less extreme than mania. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania, your hypomania, you may feel very excited and happy, almost euphoric, full of energy or unusually irritable. Sorry, these mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Although bipolar, my apologies, I got lost a bit. So, episodes of mood swings from depression to mania may occur rarely or multiple times a year. So, each bout usually lasts several days. Between episodes, some people have long periods of emotional stability, otherwise may frequently have mood swings from depression to mania, or both depression and mania at the same time. So although bipolar disorder is a lifelong condition, you can manage your mood swings other symptoms, I do apologize, by following a treatment plan. In most cases, healthcare professionals use medicines and talk therapy, also known as psychotherapy, to treat bipolar disorder. Bipolar disorder, you've had at least one manic episode that may come before or after hypomanic or major depressive episodes. In some cases, mania may cause a break from reality. This is called psychosis. So, bipolar 2 disorder, you've had at least one major depressive episode and at least one hypomanic episode, but you've never had a manic episode. So, cyclothymia, you've had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms and periods of depressive symptoms. These symptoms are less severe than major depression. So other types include bipolar and related disorders caused by certain drugs or alcohol, or due to a medical condition such as Cushing's disease, multiple sclerosis, or a stroke. So these types may include mania or hypomania, which is less extreme than mania and depression. So symptoms can cause changes in mood and behavior that can't be predicted. So this can lead to a lot of distress and cause you to have a hard time in life. So bipolar 2 disorder is not a milder form of bipolar 1 disorder. It's a separate diagnosis. So while the manic episode of bipolar 1 disorder can be severe and dangerous, people with bipolar 2 disorder can be depressed for longer periods of time. So bipolar disorder can start at any age. but usually it's diagnosed in the teenage years or early 20s. And symptoms can differ from person to person, and symptoms may vary over time. Uh, Sorry, I do apologize. Um, so, mania and hypomania are different, but they have the same symptoms. So, mania is more severe than hypomania. It causes more noticeable problems at work, school, and social activities, as well as getting along uh, with others. So, mania also may cause a break from reality, known as psychosis. So you may need to stay in hospital for treatment. Manic and hypomanic episodes include three or more of these symptoms. So there's been much more active, energetic, or agitated than usual. Feeling a distorted sense of well-being or too self-confident, needing much less sleep than usual, um, being unusually talkative and talking quite fast, having racing thoughts or jumping quickly from one topic to another, and being easily distracted. Um, so making poor decisions. So, for example, you may go on a buying spree, take sexual risks, or make foolish investments. Um, the major depressive episodes include symptoms that are severe enough to cause you to have a hard time doing day-to-day activities, um, including going to work or school, as well as taking part in social activities and getting along with other people. So an episode usually includes five or more of these symptoms. So having a depressed mood, you may feel sad, empty, hopeless, or tearful. Children and teens who are depressed can seem irritable, angry, and or hostile. Having a marked loss of interest or feeling no pressure in uh, all or most activities. Losing a lot of weight when not dieting or overeating, and gaining weight. When children don't gain weight as expected, this can be a sign of depression. So, sleeping too little or too much, feeling restless or acting slower than usual, feeling very tired or losing energy, feeling worthless, feeling too guilty, or feeling guilty when it's not necessary, having a hard time thinking or concentrating, or not being able to make decisions. So, thinking about planning or attempting suicide. Other features of bipolar disorder um, may include anxious distress when you're feeling symptoms of anxiety and fear that you're losing control, um, and melancholy. So, when you feel very sad uh, and have a deep loss of pleasure. So, then there's psychosis when your thoughts or emotions disconnect from reality. The time of symptoms may just be described as mixed when you have symptoms of depression and mania or hypomania at the same time. So, rapid cycling, when you have four mood episodes in the past year where you switch between mania and hypomania and then major depression. So, also bipolar symptoms may happen when you're pregnant. So, symptoms can change with the seasons also. So, symptoms in children and teens um, can be hard to identify in children and teens. It's often hard to tell um, whether these symptoms are the usual ups and downs or due to stress or trauma, um, or if they're signs of a mental health problem other than bipolar disorder. So, children and teens may have distinct major depressive or manic or hypomanic episodes. So, but the pattern can vary from adults with bipolar disorder. So moods can shift fast during episodes. So some children may have periods with mood symptoms between episodes. So the most noticeable signs of bipolar disorder in children and teens may be severe mood swings that aren't like their usual mood swings. So generally, when to see a doctor is despite their mood extremes, people with bipolar disorder often don't know how much they're emotionally unstable, disrupting their lives and the lives of their loved ones. So, as a result, they don't get the treatment they need. So, it's really quite important to make sure that, they do seek medical attention. So, if you like some people with bipolar, sorry. So, if you're like some people with bipolar disorder, you may enjoy the feelings of euphoria and cycles of being more productive. But an emotional crash always follows this euphoria. So, this crash can leave you depressed and worn out. If it could cause you to have problems getting along with others, uh, it could also leave you in a financial or legal trouble. So, if you have any symptoms of depression or mania, you should really see your healthcare or mental health professional um, if it doesn't get any better on its own. Um, so, when to really see emergency help is generally when there's thoughts of suicide, and acting on these thoughts are common for people with bipolar disorder. If you are thinking of hurting yourself, or if you have a loved one who is in danger of um, unaliving, um, of which I, must say for the rules, or attempting unaliving, get help. You can let a family member or friend know, or you can contact a hotline, or 911 or 000, or 999, depending on where you're located. Um, there is always help, and there is no shame in asking for help. So, for the diagnosis, to find out if you have bipolar disorder, your evaluations may include a physical exam. So, your healthcare professional may do a physical exam and lab tests to find any medical problems that could be causing your symptoms. So, mental health assessment, your healthcare professional may refer you to a psychiatrist who will talk to you about your thoughts, feelings, and behavior patterns. You may also answer a series of questions with your permission. Family members or close friends may be asked to provide information about your symptoms. Mood charting, you may be asked to keep a daily record of your moods. Or sleeping patterns or other factors that could help make the right diagnosis to get the right treatment. And I really firmly agree with that. So I actually have a personal journey with that. I had my ups and downs. I really showed symptoms of bipolar disorder. I was sent to a psychiatrist, which is obviously the proper protocols after I had some general tests done, just to try to make sure there wasn't anything abnormal in my blood tests and things like that. I went to see the psychiatrist, and it looked like I had bipolar disorder. And so I was put on lithium and quite a few other medications for mood stabilizing. As it appeared, I may have had a mild case of psychosis as well. And I quite literally was knocked out to the point where I was sleeping 22 hours a day, and really struggled to stay awake. And my now ex-husband was, for those other 2 days, was forcing me to get out of bed just so I could eat. And then I'd just go back to bed and sleep. And then it got to the point where he came with me to an appointment, as it said before, to be able to talk to the psychiatrist and talk about my symptoms, etc. And that's when my psychiatrist said, no, there's something not right here. I'm going to send you to a neurologist. So I got sent to a neurologist, and it turned out I didn't have bipolar disorder. I had epilepsy. So it is really important to seek medical advice. And, you can always seek a second opinion. And this is where those tests do come in handy and involved, is because, and I'm not saying that there was anything shameful if I had bipolar disorder. It just explained why the medication turned me into a zombie, and it really just knocked me for six, and I really had no emotion left. So I felt nothing. So yes, and then it turned out, after seeing a neurologist quite soon after that and going through all my tests with them, it turned out that I had I had temporal lobe epilepsy, sorry. And then once I started going on medication for that, all of my symptoms started to subside. So that was quite interesting. It, showing how much that, some symptoms can overlap with different disorders. So diagnosing in children, although children and teenagers with bipolar disorder are diagnosed based on the same criteria used for adults, symptoms in children and teens often have different patterns. So these patterns may not fit neatly into diagnostic categories. So children who have bipolar disorder are often diagnosed with other mental health conditions such as ADHD or behavior problems. This can complicate a diagnosis. So these complicate a diagnosis. Sorry. So these children may need to see a child psychiatrist with experience in bipolar disorder. So the treatment is best guided by a medical doctor who diagnoses and treats mental health conditions, which is known as a psychiatrist. So they need to be really skilled in treating bipolar disorder and related disorders. So your care team may also include a psychologist, social workers, and psychiatrist nurses, and also psychologists as well, because it's not usually just medication that's involved. It's also things like psychotherapy, which is usually done through a psychologist. So depending on your needs, obviously your treatment will vary, and there are quite diverse treatments, of which I won't go into because this isn't for medical advice. It's just awareness purposes only. So there are quite a few medications there that they can use, and it is usually trial and error to get to that right treatment that can work for you, and everybody is different. There's no textbook treatment for bipolar disorder. So it's quite difficult to find that right treatment at first, and they usually do come with side effects, but after a few weeks, those side effects I found they do generally start to settle. If not, then obviously you talk to your psychiatrist and and then go from there. So if you do have concerns about yourself or a loved one, please do try um, to really go to try to get them to um, a psychiatrist or even a general practitioner who can then, you know, refer you to where you need to go, because sometimes it could be you need to go to hospital for an assessment or as an emergency or see a psychiatrist. The reason why I am doing bipolar disorder today is because I do uh, I do deep dives on topics that my listeners, request. And so, if you do have a topic that you would like to have a deep dive on and raise awareness for, please let me know. So, today's one for bipolar was requested to raise awareness. And, you know, part of what this channel is for is to try to break those stigmas and really get people to understand and, you know, hopefully spread the awareness and information out there about mental health, because it is so misunderstood, especially with, uh, you know, mental illness about schizophrenia, bipolar disorder, borderline personality disorder, you know, and even depression. Like they all have a stigma, and so that's what we're trying to do is raise awareness. Hopefully, you know, start removing that stigma and getting people to understand a bit more. Um, you know, especially if they know somebody in their life circle that you know, has that condition, and it helps them to be able to support people that come into their life with these conditions, because it is quite difficult living with these conditions. So, you know, especially with the mood disorders, but they become quite difficult. And with bipolar disorder, you know, they can become quite compulsive as well. So they can, you know, go on a spending spree, etc. You know, and it's all impulsive as well. It's all very last second. So, you know, they go walking through a shopping centre and then all of a sudden see a shop they like, and, you know, not rationally go in and purchase, you know, a lot of money that realistically they can't afford, and that money was actually designated for bills or shopping or something like that. So I really just want to spread that awareness, and I'm hoping that um, somebody could even come forward to be a guest speaker with me, and you know, if you're happy to share your journey, or even as a carer or support person, you know, because you're just as important. And part of this channel is also about uh, supporting the supporters for chronic illnesses, invisible disabilities, and disabilities. So, because the support people are just as important, and they need to be recognised. And, you know, I really think it's important that, you know, both sides need to be seen. So, if somebody who has watched or is watching, please send me a message if you would like to either add something into the deep dive list, so I can go through, do some research and raise some awareness. Or if you're happy to come on as a guest speaker and have a chat with me and share your journey as either somebody who, and it doesn't have to be bipolar disorder, it could be for any type of disorder, for any of those, you know, umbrellas for the chronic illness, disabilities and invisible disabilities, and the carers and the guardians and support people. So I think it's really important that we really start getting this information out there and sharing the awareness. So I really appreciate everybody listening today and for your support. And once again, I do apologize for not looking into the camera. I am blind. So I really do appreciate your patience, especially when I stutter and I freeze because I get lost my text to speech that I've got written out. Another thing that you can do is you can go to the Mayo Clinic, and they've got plenty of research there as well as I believe the Cleveland Clinic. And there's a lot of support groups out there as well, which are great. If you're going to go to an appointment, I think it's also great to write down a list of questions if you have them, and also maybe take somebody with you that you're comfortable and feel safe taking with you to help advocate with you, because sometimes one person may remember some information that the other doesn't, and so you can advocate with each other, which is really important. If you have that person who you feel safe in your life, or even if you have an advocacy group that you can get in contact with that can help you, so just making sure that you do have that person in that you can take with you, if you're comfortable to do so. Um, I just found it really helpful. So if you do have any questions as well, please do send me a message. And we also do have a subreddit, Spoony Life and Beyond, where you can post as well. So thank you so, so much to everyone for your support and for your time for listening to my rambling on. And I shall see you in the next video. Bye. Mwah.